The Violence, Abuse and Mental Health Network is funded by UK Research and Innovation and has been established to understand, prevent and reduce the impact of domestic abuse and sexual violence on mental health. This interdisciplinary national network has over 1,200 members and aims to reduce the prevalence of mental health problems by bringing together experts with different ways of thinking about violence, abuse and mental health. Some who have personal experience of these issues, others with expertise from the work that they do, and also those who bring multiple forms of expertise. We've run a range of activities specifically for early career researchers, including grant writing workshops and lunchtime career development sessions, as well as awarding bursaries. These activities have provided a space for early career researchers to get high quality and tailored advice from senior academics and from each other to help improve their skills and prospects as researchers.
Between 2019 and 2021, the network ran 3 funding calls centering on the themes of measurement, understanding, and interventions around violence, abuse, and mental health. We awarded 12 projects with funds of up to £25,000 each, and many early career researchers were able to launch their own research projects with access to this funding. All of the projects that we funded included significant and meaningful involvement with experts by lived experience in the research design, implementation, and dissemination of the results. In 2022, the network funded artistic public engagement projects that furthered the discussion around violence, abuse, and mental health, and we worked in collaboration with Riverside Studios. We awarded 5 project teams of artists, researchers and experts by lived experience with funding of up to £15,000 each. These arts-based projects promote a range of interdisciplinary and cross-sector working and methodologies, all in an effort to share the experiences of survivors with a wider public and engage people in a really thought-provoking conversation around violence, abuse, and mental health.
The Lived Experience Advisory Group, or LEAGUE for short, is integral to the way the Violence, Abuse and Mental Health Network runs and ensures that all activities provide opportunities to empower the voices of survivors. We work with survivors' voices to shape the research questions that those with lived experience felt were most important, and this shaped the grant funding that the network has awarded. LEAGUE members have been involved in funding decisions, webinars, journals commentaries, and they are also working on a series of best practice guides. They also conduct survivor-led research that addresses key gaps in the literature and explores what best practice looks like when it comes to co-production within mental health research. The LEAGUE is integral in ensuring that the work of the VAMHN makes real-world difference to those with experiences of violence, abuse, and mental health.
VAMHN is a thriving network that has successfully helped members to recruit research participants, find cross-sector collaborators for grants, conduct and disseminate research, and share resources widely through our online forum, newsletter, online directories, and very exciting network events that we hold. Please join us to better understand, measure, and intervene to prevent and respond to violence and abuse in order to decrease the prevalence of mental health problems in society. This can only be achieved if we all work together.